What the color of your stool tells you about your health. The color of your stool may be one of the first warning signs your body gives when something's not right inside. I know it's not the most glamorous topic, but trust me, it's one you need to understand. What you see in the toilet bowl isn't just waste, it's a message. A greenish tint could mean your food is rushing through digestion. A black stool might be a silent alert from your stomach. And that pale, clay-colored poop could be a red flag from your liver or gallbladder. In this video, I'll tell you what the color of your stool really says about your health. Of course, if you notice unusual colors sticking around for more than a few days, don't ignore it. Please consult a healthcare professional. And stay tuned till the end, because I'm also sharing 5 powerful foods that help protect your bowel movement and keep things running smooth, literally. Now, let's start with the video. 1. Brown. Most people don't give a second thought to their stool, especially when it's brown. The journey begins in your liver. That's where bile is made, a yellow-green fluid that helps break down fats. Once produced, bile is stored in the gallbladder and released into your small intestine when you eat. As bile travels through your digestive system, it mixes with what's left of your food, and along the way, gut bacteria break it down into pigments. These pigments are what gives stool its classic brown shade. So when you see that color, it usually means bile flow is steady and your digestion is on track. According to PubMed, stool color in infants commonly changes from yellow at 4 weeks to brown by 6 months, reflecting normal digestive system development. But if the brown tone looks different, either too dark, almost black-brown, or pale brown, it could signal an underlying imbalance. One reason this may happen is if your liver starts producing too much bile, often triggered by chronic alcohol intake or long-term medication use. Over time, these habits strain your liver and change the chemical makeup of bile. That excess bile may deepen the brown tone of your stool, which might go unnoticed until other symptoms like bloating or fatigue show up. To protect yourself, it's key to stay hydrated, limit processed foods, and eat meals rich in bitter greens like arugula and dandelion. They naturally support healthy bile flow. Reducing alcohol and managing stress also help your liver stay balanced and responsive. 2. Green. Stool doesn't just change color randomly. It's a direct result of how well your digestive system is breaking things down, especially bile. And when bile doesn't get enough time to do its job, your stool ends up looking green instead of the usual brown. According to scientific reports, when stool moves too quickly through your intestines, like during a bout of diarrhea, it doesn't give bile pigments enough time to break down and change color. Instead of turning the usual brown, the stool holds onto the original green shade of bile, showing up as green in the toilet. This indicates that your digestive system is moving too quickly, skipping important steps in the digestion process. Furthermore, the consumption of plant-based foods or smoothies that are full of spinach, kale, or wheatgrass is another common cause of this phenomenon. Chlorophyll, the pigment that makes these nutrient-rich foods green, may tint your stool if you eat too much. It might seem harmless, and often it is, but if green stools keep showing up even when you're not eating many greens, it could point to an imbalance in gut bacteria or a bile absorption issue. In some cases, people with bile acid malabsorption or even early Crohn's disease may show this kind of color pattern before other symptoms appear. To stay in the safe zone, make gradual dietary changes instead of sudden overhauls. Introduce fiber-rich greens slowly so your gut may adjust. Keep your hydration levels steady to avoid speeding up your digestion too much, and include fermented foods like yogurt or kefir to support your gut bacteria. 3. Yellow. If you look down and notice a bright yellow color in your poop, especially if it's greasy or has a strong odor, your digestive system might be telling you it's not breaking down fats the way it should. When you eat, your pancreas releases enzymes to help digest proteins, carbs, and especially fats. At the same time, your liver sends bile into the small intestine to emulsify fat so your body may absorb it. If something goes wrong in that chain, if the pancreas isn't delivering enough enzymes, or if bile isn't working properly, those fats don't break down. They pass through your gut and end up in your stool, which gives it that yellow, sometimes shiny look. The stool may float or stick to the sides of the toilet. Moreover, there is also a condition known as bile acid malabsorption that may cause individuals to have yellow stools. It happens when your body can't properly reabsorb bile salts in the small intestine. This condition keeps bile circulating too quickly or spilling into the colon, irritating it and changing the texture and color of your stool. While this may sometimes result from an intestinal surgery or a gut infection, in other cases, it might be tied to conditions like irritable bowel syndrome or early celiac disease. It often starts with mild digestive discomfort and yellowish stools, but may quietly progress if not addressed early. According to PubMed, extrahepatic biliary atresia in newborns often presents with yellow or pale stools due to lack of bile pigment, and unrecognized stool discoloration may delay diagnosis. Avoid processed, greasy foods that overwhelm your system to protect yourself from yellow poop. Include bitter vegetables like dandelion greens or artichoke, which gently stimulate bile production. 4. Black. Black stool has a way of stopping you in your tracks. That deep, tar-like shade isn't just from what you've been eating. It may be a sign of something much more serious happening inside your body. According to PubMed, when blood loss from the upper gastrointestinal tract exceeds about 3 ounces, it often results in black, tarry stool known as melena. This happens because the blood gets partially digested as it moves through the intestines, giving the stool its dark, sticky appearance. It's one of the clearest signs of upper GI bleeding and shouldn't be ignored. Furthermore, there is also the possibility that a bleeding esophageal varix is the cause of that black stool. These are swollen veins in your esophagus, often tied to liver disease, especially in people with long-term alcohol use or untreated hepatitis. When the liver gets damaged, blood flow gets rerouted, putting pressure on nearby veins that aren't built to handle it. If one of these veins bursts, it may cause significant bleeding. The blood mixes with stomach contents, turning the stool black. It's a silent condition until a rupture happens, and black stool might be your only clue before things get dangerous. The problem here is that many people don't feel sick until the situation has already escalated, so these early signs matter. If you want to protect your health and avoid getting blindsided, it's essential to take care of your gut and liver. Limit alcohol, especially if it's something you consume regularly, and be cautious with over-the-counter pain meds like aspirin and ibuprofen. Eating smaller, more frequent meals may help reduce stomach acid irritation, and including foods rich in antioxidants like blueberries, leafy greens, and turmeric may support your liver's resilience. 5. Red. If you notice bright red blood in your stool, it typically means there's bleeding happening near the end of your digestive tract, most often in the rectum or lower intestine. According to the National Library of Medicine, this kind of bleeding is commonly caused by conditions like hemorrhoids or anal fissures. While it might not always be painful, that red streak is your body's way of signaling irritation, inflammation, or strain in your lower gut that shouldn't be ignored. Additionally, diverticulosis, a condition in which small pouches form along the walls of your colon, is another cause that is more concerning. These pouches may get irritated or infected, and when one tears or bleeds, it leads to sudden red blood in your stool. You might not feel any pain, and this can make diagnosis difficult. These episodes may be sporadic, but over time, if not managed properly, they may lead to serious complications like chronic inflammation or even abscesses in the colon wall. What's really happening here is that the structural integrity of your colon is weakening, and if your diet is low in fiber or you've been sedentary. It makes this condition more likely. To help guard your digestive tract against these kinds of issues, start by increasing your daily fiber intake. Fruits, vegetables, whole grains, and beans are your best friends. This softens stool and keeps things moving, which reduces pressure in the colon and lowers the risk of both hemorrhoids and diverticulosis. 6. White. White or pale-colored stool is one of those signs that immediately raises a red flag. One cause of white stool is a blocked bile duct, often due to gallstones or inflammation. These ducts are like tiny pipelines that carry bile into your intestines. When something clogs the flow, bile builds up, backs into the liver, and never reaches your stool. This not only changes the color, but it also puts pressure on your liver and may eventually lead to jaundice, where your skin and eyes take on a yellow tint. The scary part is that early on, the only visible clue may be pale stool. Internally, your liver could be struggling under that pressure, increasing the risk of liver infections or damage if left unaddressed. Apart from that, liver disease, particularly conditions such as hepatitis or cirrhosis, is a significant contributor to the presence of white stool. In these cases, the liver becomes inflamed or scarred and can't produce enough bile. Without enough bile from the start, the digestion of fats slows down and waste loses its normal coloring. You might also feel more bloated or fatigued or notice greasy stools alongside the pale color. What's happening here is a gradual breakdown of your liver's ability to detox and digest, often without obvious pain in the early stages. The white stool becomes an early sign that liver function is declining silently behind the scenes. According to the National Library of Medicine, white or pale stool in infants may indicate impaired bile flow and may be an early sign of cystic fibrosis. Genetic testing may help confirm the diagnosis, and pancreatic enzyme therapy often improves stool color and digestion. To support your liver and bile system, focus on foods that promote natural bile flow and liver health. Leafy greens, beets, garlic, and turmeric are powerful tools in your kitchen. Avoid heavy alcohol use, processed fats, and anything that overloads your liver. Staying hydrated and active also keeps bile moving through your system. 7. Clay-colored. Clay-colored stool has a very specific look, pale, light gray, and almost putty-like, and when it shows up, it usually points straight to a problem with bile. Normally, bile is produced in your liver, stored in your gallbladder, and released into your small intestine to help digest fats. It also acts as a waste removal system, helping to flush out excess cholesterol and toxins. When bile can't reach your intestines, whether due to inflammation or a blockage, your stool is stripped of its color. One reason this happens is due to a condition called primary sclerosing cholangitis. This is a chronic liver disease where inflammation and scarring narrow the bile ducts over time. As the ducts close off, less bile reaches the intestine, and your body slowly starts to struggle with fat digestion and detoxification. Clay-colored stool in this case is an early sign of something much bigger. Your liver may be under long-term stress without you feeling any pain yet. An additional factor contributing to this color change is the presence of a pancreatic tumor that is pressing on the bile duct. The pancreas and bile duct are tightly connected, and when something grows near that area, even a small mass, it may compress the duct and stop bile from flowing. That creates a backup in the liver and leads to pale, clay-colored stool. What's especially important here is that this change may happen quietly. A tumor might not cause pain or symptoms right away, but the stool color may change before anything else feels off. If this warning sign is missed, it delays early detection, which is key in cases like pancreatic cancer, where time is critical. According to the National Library of Medicine, when liver function declines in people with hepatocellular jaundice, their stool may turn clay-colored due to impaired bile excretion. However, if a jaundiced patient passes clay-colored stool that also tests positive for blood, it could point to a far more serious concern, such as pancreatic cancer or a tumor. To help reduce the risk of bile flow issues, focus on daily liver and pancreas support. Choose whole foods that are low in processed fats, cut back on alcohol, and include liver-friendly options like lemon water, cruciferous veggies, and berries. Regular movement and hydration also help keep bile flowing steadily. 8. Blue. The most common reason blue stool appears is due to artificial food colorings, which are used in candies, drinks, frostings, and even some medications. These synthetic dyes are not always fully broken down during digestion. When your body can't absorb them well, they pass right through your intestines and tint your stool. This doesn't always mean your gut is unhealthy, but it may indicate that your digestive system is rushing or that certain parts, like your small intestine, aren't absorbing compounds the way they should. This type of incomplete absorption may be a quiet sign of mild malabsorption or inflammation that may not yet show up with other symptoms. A more medically significant reason for blue or blue-tinged stool comes from diagnostic procedures. In hospitals or during certain imaging scans, patients are sometimes given contrast agents or dyes like methylene blue. These are used to trace internal pathways or highlight specific organs. If your body doesn't clear these agents efficiently, especially if your kidneys or liver are under stress, the dye may show up in your stool. While this is expected short-term, if blue color persists or returns after a procedure, it might suggest your liver or kidneys aren't processing toxins effectively. That kind of slowed detox function may also appear with fatigue, brain fog, or changes in urine color, but it often starts with your stool giving the first visual cue. According to BMJ Open Access, researchers conducted a study where participants first consumed a standard diet for one day. The following day, they ate 2 muffins containing royal blue food dyes. Their stool turned visibly blue. This experiment showed just how directly synthetic food coloring, especially strong dyes like royal blue, may influence stool color when the digestive system doesn't fully break them down. To reduce the chances of dealing with dye-related stress on your system, start by minimizing artificial colors in your food, especially in snacks and processed items. Moving on, 5 powerful foods that help keep your bowel movements smooth and regular. Nobody enjoys talking about bowel movements, but when things aren't moving right, you feel it all day. Just adding the right foods to your daily routine may make a massive difference. So if you're tired of feeling stuck, literally, here are 5 simple foods that may help keep your digestion running like clockwork. 1. Kiwi. This little green fruit is a natural digestion booster. Kiwi contains a special enzyme called actinidine that helps break down proteins and ease the movement of food through your intestines. It's also rich in soluble fiber, which helps soften stool and prevent that heavy, sluggish feeling after meals. 2. Chia seeds. When you soak chia seeds, they form a gel-like texture that acts like a gentle broom in your gut. These tiny seeds are packed with omega-3s and fiber, especially the type that keeps things moist and easy to pass. Just a tablespoon in water, yogurt, or a smoothie may help things move along naturally. 3. Cooked oats. Warm, cooked oats are a go-to for good reason. They contain beta-glucan, a soluble fiber that not only improves stool consistency but also nourishes your gut lining. Unlike cold cereal, cooked oats are easier on your system and may help create a smoother, softer stool texture. 4. Prunes. They're not just for your grandparents. Prunes really work. They contain sorbitol, a natural sugar alcohol that draws water into the colon and encourages gentle, regular movement. A few prunes in the morning may jumpstart your digestive system without any crash later in the day. 5. Avocado. Besides being delicious, avocado is loaded with healthy fats and fiber, 2 things your digestive system loves. The creamy texture helps lubricate your intestines, while the fiber keeps waste soft and easy to pass. It's basically a 1-2 punch for smoother, more comfortable bowel movements. While a random change in stool color might not be a big deal, if you start noticing consistent or dramatic shifts, your body could be trying to tell you something important. I want you to think of each color like a coded message. Your liver, gallbladder, pancreas, or intestines might be waving a silent flag. Your stool is directly tied to how you're digesting, absorbing, and eliminating what you eat. When things go off track, your body doesn't always shout, it whispers through these subtle signs. If I see something unusual, I don't just brush it off. Please talk to a healthcare professional right away. Today we learned about all the things that our stool color has to say about our health. But do you know that many other foods may offer impressive health benefits? Want to find out more? Watch 10 health benefits of 1 spoon of honey every day. Or watch 11 health benefits of apple cider vinegar. You may watch either or both of them. Have you ever noticed any unusual stool color that was not mentioned earlier? Let us know in the comments section below.